Yo, how come nobody told me that trying to get off mental health care medication was gonna be like trying to cancel cable in your early 2000s? Nobody told me nothing. Alright, so cancer is traumatizing as fuck, and I needed trauma therapy to help cope with the trauma of having cancer, on top of all these other things that I was dealing with in my personal life. And I felt really anxious at the end of like 2023 when I was first learning about everything happening in Gaza, and then learning about everything happening in Congo, in Sudan. And every time I got on TikTok, Instagram, I saw so much traumatizing things that, on top of going through my own trauma and my own personal situations, was literally driving me nuts. So I was in therapy. My therapist is not a psychiatrist. She was a psychology grad student, getting her hours in to get her degree. And I was talking to her about the situation and how it was affecting me, and she recommended that I go see a psychiatrist to get a prescription for anti-anxiety meds. Now, I had already had a prescription for anti-anxiety meds, but it was like a tranquilizer that you take every once in a while to help you to stop or prevent having a panic attack, an anxiety attack, like being so stressed out to the point where it becomes a medical emergency, because I needed that in order to go through chemo treatment. I did not want to go through chemo treatment. I was terrified of the experience. I didn't want to, deal with constantly being poked and prodded and the whole experience and whatnot. Like, it was very overwhelming and very traumatizing and very dark. So, with that said, this is how I got into the situation to begin with. So she recommended me to a psychiatrist. So when she recommended me to the psychiatrist, someone had reached out to me from the psychiatry team. Now, I never met this psychiatrist. I never had any phone calls with him, any like virtual appointments with him. I never had an in-person appointment with him. I do not know this man. I could not pick him out in a lineup. I cannot match the name to the face. So this person reaches out to me, and she's a psychiatry social worker. And she introduces herself and she explains that she's going to be my point of contact. She asks me a series of different questions about my anxiety. She takes notes, and she's like, okay, I'm going to talk to a psychiatrist, and based on my notes, we'll get back to you and let you know what he prescribes for you. So she calls me like once a week or so. So this is, a period of months. So this started in like November 2023, and then it went all the way to 2024, like sometime in the summer, and it really wasn't supposed to go there. So let's get into the first lies that I was told about this medication. So she gets back to me and she tells me that, great news, the psychiatrist recommended medication. We're going to try this out for about 30 days, and we're going to see how it affects you. If at the end of this 30 days you no longer want to take this medication, then you don't have to continue taking it. We can recommend you a different medication. If you decide to stop taking medication altogether, then, and you just want to do talk therapy instead, then that's totally fine. So I get the prescription and I'm reading the side effects, and I'm concerned because the side effects of this anti-anxiety medication that she gave me was Like, it was a giant red warning on the prescription saying, like, warning, can increase thoughts of suicide. Warning, can increase depression. And I just thought that was so counterproductive. What the hell is going on? So I didn't take these pills. She calls me back next week, and I'm explaining to her my concerns, and she's just like, we have to put that warning label on all medications for all psychological issues, whether you have depression, anxiety, bipolar, or what. That is a warning label that we are legally required to put on all the medications. Don't be alarmed by that. That only happens in very extreme circumstances. And if you do experience things like that, then you need to let us know and we can proceed from there. But that's not the experience that you're most likely to have when taking these pills. So I started taking these pills. She's checking in with me once a week, asking about the side effects and whatever. And about like 3 weeks into these pills, I'm like, I had 2 periods. And this was not listed in the side effects. One, I know for a fact that most medication is not tested on women. It's tested on young white men. It's not tested on women, and it's not tested on people of color. So, of course, the side effects aren't on the prescription list. But when I Googled that medication and getting 2 periods, tons of articles came up. Tons of videos came up. And they all said the same thing. Your doctor is going to gaslight you and tell you that this isn't a side effect of this medication and that you have gynecology issues. And that is exactly what happened to me. So I told her, I don't want to take these pills anymore because it gave me 2 periods. I'm not interested in having 2 periods. That is stressful. I don't want to be bothered. Take me off these pills. At that point, it had already been 30 days. She tells me that's not a listed prescription of the medication. You have gynecology issues. I'm going to put a note in your file and send to gynecology. I tell her, don't do that. That's not necessary. This is a side effect of them pills, and it's not going to be in your files because they don't test on women, because they don't want to deal with the variables that come with periods, that come with people being pregnant. They don't want to deal with the variables that come with women's hormones. And they don't test on people of color. They only test on mostly young white men. Young white, cisgender, heterosexual men. Okay? Just want to put that out there. So, I'm being very adamant, like, no, you told me that if I took this medication for a month and I didn't like it, that I could stop taking it. And then she tells me, you can't stop taking these pills because it's already been a month. They're already in your system. You have to continue for at least 6 more months. Lie number 2. And we're going to get into how I figured out that that was a lie. So I reluctantly allowed her to continue writing me prescription after prescription after prescription, month after month after month. And I was experiencing lower energy, heavier fatigue. And I just felt like the life was being drained out of me. And it was making me feel more anxious and more depressed. And every time I tried to tell her, I don't want to take these pills anymore. I don't like the side effects. She's like, well, you can't stop taking these because they're in your system. You need to take them for at least 6 more months, blah, blah, blah. Like, every time I tried to tell her that I wasn't interested in taking the pill, she'd ask me why. And then I would tell her why. And then she would have a rebuttal for that. And it wasn't until I was like, I don't want to take these pills anymore. How do I get off these healthily? How do I get off these pills safely? I don't want to take these pills anymore. And she kept telling me that I couldn't. It's not safe, it's not safe, it's not safe. And then I told her that if you don't tell me how to get off these pills safely, I'm just going to stop taking them. And she'd be like, no, don't do that, blah, blah, blah. It wasn't until months later that I had decided to lower my medication. So instead of taking these every night as prescribed, I would take them every other night. I would take them every other 2 days, every other 3 days, or whatever. And then that's when I started to gain clarity. And that's when I started to understand what was going on. But because of those pills and how much fogginess and confusion it caused in my brain and talking to this person, it took me so long to realize that when I was talking to her about my issues, that I just had the realization that I'm not speaking to a medical professional. I'm talking to a salesperson, because I've worked sales jobs and I know the whole rebuttal team. I know the whole training. And that's exactly what this is. It was like trying to cancel cable in the early 2000s. Like, you ever tried to cancel cable in the early 2000s and you go to the website, there is no button. There is a number. It's a 1-800 number. You can't speak to a person. It's a robot. You gotta Google how to get through customer service and speak to a person, and go through pages after pages after page after pages and try out several numbers here and there, and just to finally get to a person. And then they transfer you and they transfer you and they put you on hold and they put you on hold, hoping that you'll hang up, hoping that you will give up. And then when you finally do speak to a person, hopefully they speak English and you can understand each other, and you're like, I want to cancel cable. And you're like, why? And you're like, I don't want cable anymore, it's a waste of money, blah blah blah. And you're like, well, actually we can give you a lower we could offer you a lower rate. And you're like, well, I still don't want this. Well, actually we can add the phone. I still don't want this. Well, actually we can give you a lower rate and you can add your home phone and a cell phone. I don't want this. Well, actually you can have the home, the computer, the cell phone, and you can set this up at your job as well. I don't want this. Like, and they just keep offering you shit to try to shut you down. Like, that's what it felt like talking to this person. So anytime I would be like, I want to stop taking these pills because it gave me 2 periods, and that's ridiculous. I don't want 2 periods. That's a gynecology issue that's not even the listed side effect of these pills. Okay, strike number 1, trying to gaslight me about my own fucking experiences. Strike number 2, I would say, these pills are draining my energy and giving me severe head fog and stuff, and I don't feel like myself. And she'd be like, okay, but you just had cancer. You went through rigorous amounts of chemo. You went through rigorous amounts of radiation. You have hypothyroidism. And you're also taking this medication for this, and you're taking that medication for that, so fatigue is normal. I'm like, no, I know what my normal fatigue is based on my health issues, and this isn't it. This is more. So she was trying to gaslight me into believing that the side effects that I was experiencing wasn't the side effects that I was experiencing. She tried to attribute it to this thing or that thing and this thing and that thing. And then she put that order in for gynecology. So my gynecologist, I had requested to have a female gynecologist. I told them, do not schedule me for another gynecology appointment unless it's going to be with a female doctor. So I finally got the appointment in to see the female doctor. But they insisted on doing this transvaginal ultrasound because she put that order in for me to go see them for that issue of me having 2 periods. And I tried explaining to them, like, I don't think I need this appointment. I don't understand how getting this invasive procedure in April is going to tell you why I got 2 periods in November. That doesn't make any sense. Can I just do my regular appointments? And she was like, yeah, sure. And she canceled it. So when I canceled that transvaginal appointment that was only put in there based on the word of the social worker that was trying to gaslight me, my gynecologist canceled my appointment to see me. And when I called to see what's going on, why did my appointment get canceled? And they're like, well, we don't have anything to diagnose you with because you canceled this appointment. And then I explained the situation and they rescheduled it. But it took months just to see it. And I need to go to the gynecologist every 6 months because I tested positive for the BRCA gene, and they have to make sure that I don't show any signs of, cervical cancer or anything like that. So because of her lies and her gaslighting, she caused me to have my medical attention delayed because she wants to gaslight me into believing that my side effects aren't the side effects of the pills. And then she kept trying to convince me that I couldn't stop taking these pills because it's not safe to stop cold turkey and whatever. So when I went in for a separate appointment, I went to go see my oncology nurse. And I told her, how do I get off these pills safely? And she gives me the rigmarole. She's taken aback. She's asking me questions like, well, why do you want to get taken off the pills? I explained to her the side effects. And she is also trying to say, like, well, what did the psychiatrist say? And I said, I have not met my psychiatrist. I've only been in contact with the psychiatry social worker. And every time I've asked to meet the psychiatrist, the social worker tells me I can't meet the psychiatrist, that she will be my only point of contact, and she will be the only one making decisions on my health care in terms of my medication and needs. And I keep telling her that I'm not interested in taking this medication anymore and asking her how to get off this safely, and she will not tell me. She keeps telling me that I have to keep taking these pills, and I know that is not true. So how do I get off this medication safely? And it's called titrate. That's the process of getting off medication safely. So she was like, that's weird. That's not supposed to happen. I'm going to send her a message because I'm looking at your file and I'm looking at these pills, and these aren't even the type of pills that you would have to safely get off of. You can stop taking these anytime you want, and you won't experience any type of negative effects. So I said, cool. And I slowly stopped taking those pills. And then, all of a sudden, she calls me either later that day or the next day to say, oh, congratulations, I talked to the psychiatrist and you can get off these pills safely. You actually don't need a titrate plan.
The fuck you lying? Why?
It's like, nah, you got a message from my oncology nurse and she called you out on your shit that I have been calling you out on for the longest time, and now you have accountability and you're trying to backtrack. Bullshit. So I'm talking to my regular therapist about the issue that I'm having with this social worker, and I guess she took it personally because I was like, I don't want to talk to this lady anymore. She doesn't listen to me. She's making decisions about my health on my behalf. She's not even a doctor. I don't even understand how a social worker is allowed to write me a prescription for anti-anxiety meds and tell me that I can't speak to my doctor about it, and tell me lies about getting off the medication safely to try and manipulate me into continuing to take the pills. And then I told her when she called, like, yeah, I already stopped taking these pills because the nurse already told me that what you have been telling me isn't the truth. And I've already slowly stopped taking these pills in the first place. And I don't want another prescription. The next month I won't be picking it up. Do not put that in the system. I won't be picking it up, and I don't want my insurance bill for it because that money can be used for other medications that I need. And she is just, I don't know, she just asked me questions about it. So my regular therapist is trying to convince me that I need to talk to the social worker and explain to her what she's doing to make me feel uncomfortable and why I don't want to talk to her. But really, I just didn't want to talk to her. My final straw with this social worker was she had asked me what my plans for summer, and I didn't really want to talk to her about my plans for summer because I was planning on going to Vegandale, and I didn't want to have a conversation with the idiots. Basically, I didn't want to have a conversation with the idiots, and that's what ended up happening. So reluctantly, I told her I had plans to go to Vegandale the following weekend with my sister. And she was like, oh, are you vegan? And I said yes. And she's like, oh, that's why, that explains a lot. You need red meat for iron. That's why you're so low energy. That's why you're so low fatigue. That's why you're anemic. You need red meat for iron. Oh my gosh, you should have told me. I would have been told you that you just need to eat a burger. And I was like, no, the only reason why I'm anemic is because I had cancer and I went through chemo, and I'm anemic as a side effect of cancer and chemo. If you were a nurse, if you had medical training to read the files, you would have known that. But instead, you want to try and again blame the side effects of this medication on something else that has nothing to do with that. I didn't tell her that I was a vegan because I didn't want to have a conversation with an idiot, and that's what ended up happening. When you tell medical professionals that you're vegan, they try and attribute your medical condition to you being vegan and not other issues, and that's not the case. And before you say anything, this is how I know that this concern isn't a genuine concern for my overall health and well-being. My partner isn't vegan, but he doesn't eat red meat. He don't eat pork. He don't eat beef. You know, he don't eat goat and lamb or anything like that. The only meat he eats is chicken, and that's like 3 times a week at best. Occasionally during the holidays, like he'll have turkey. Sometimes, a few times a year, he may meet up with somebody and they decide to go get seafood, whether that's sushi or like a seafood boil, or Red Lobster, or something adjacent to that, or what. And when he goes to the doctor and he tells the doctor that he doesn't eat red meat, they don't try and tell him that he needs to eat red meat for iron. They don't say that to him, but they say that to me because 1, I'm a woman, 2, I'm black, and 3, because people like to talk to you like you're a damn idiot because you don't eat the same shit as them. I have not eaten meat since I was 18 years old. Okay, so I was in the middle of editing this video and I kind of got sidetracked. My thoughts are kind of inconsistent at times. But what I was meaning to say is that for someone to be so concerned for my health because I don't eat meat, and I haven't eaten meat since I was 18 years old, and before I got cancer, I never had any major health issues, to the point where I had all these blood tests done, and they're like, well, I don't understand how she has cancer and she's so healthy. Everything is running perfectly smoothly. I didn't have anemia. Before I started chemo treatment, or all these other health issues are solely the result of cancer, and I would not have been able to be a healthy person if I didn't understand what the fuck iron is and how you can get it without eating red meat. Y'all act like lentils and beets and chia seeds and iron pills and all this other stuff doesn't freaking exist. I would not be able to function if I didn't know what the fuck an amino acid is. What's so annoying about people trying to explain to me and talk down to me about eating meat and protein is that most of those people don't know what the fucking amino acid is. Protein. Most of those people don't understand that beans and rice is a complete protein because it has all 9 essential amino acids. I wouldn't be able to be a healthy, functioning person without understanding what the fucking amino acid is, or how to get iron without eating red meat. And again, my partner, he doesn't eat red meat and he doesn't have anemia, and they don't have those conversations with him when he goes to the doctor. So it's specifically a bias towards plant-based people that is specifically annoying in a medical setting, because they try and act like the problem isn't the problem. The problem is that you don't eat meat. And they try and disregard everything else that you have going on because they don't like that you don't eat meat. And they try and explain to you very basic things that they don't think that you understand. And half the shit they're trying to explain to me, they're loud and wrong about. And then if you try and correct them, They're like, well, I'm a doctor, I'm a nurse, I'm a social worker, well, I work in a hospital, I work in healthcare. And it's like, clearly you don't work enough to understand those basic things. Clearly you don't understand my understanding of things. And you don't even bother to ask. You just assume that I'm just an idiot. I don't eat meat because I'm an idiot who doesn't understand basic things like iron and amino acids in B12. I wasn't deficient in any of the things before I started treatment. The only deficiencies I have now are a result of the treatment and the cancer, and the reasons why I have to take so many pills now. So before you fix your mouth to explain to me about the health implications about eating meat versus not eating meat, use your brain and understand that I have one too. And don't come to me with the BS, because I try to be nice and I try to be patient, and I'm not gonna curse you out, I'm not gonna yell or call you out your name or anything. I'm gonna try and hear you out. But once I tell you I understand and I know all these different things and I don't need this explained to me, then you should just stop talking and change the subject. And I shouldn't have to defend myself like this. It's really dumb. Just do better. Half the people that try and be like, it's unhealthy that you don't eat meat, they're the most unhealthiest people I've ever seen. Not just because of their diet, but because of their lifestyle. Y'all don't even work out. Half of y'all don't even drink water. Y'all only poop like once a week. You're quite literally full of shit. And you're coming to me with this. It makes no sense. So that was the last straw with her. And so when she called again, I saw the phone ringing and I knew it was her, but I was asleep. And I was like, I don't even feel like waking myself up to answer this phone, because I already told the therapist that I want nothing to do with her. And the nurse already told her to stop prescribing me those pills. And like, we've already established that the doctor's not going to prescribe me anymore. So if I'm not on the pills anymore, we don't have anything to talk about. I feel like she was going to try and convince me to be on those pills again. And we've been having this conversation for months. I started those pills in November, and I could not get off of them until like May or June or something. It was completely ridiculous. I would not be alive and well-rounded as I am now. One of the only reasons why it was possible for me to survive cancer in the first place is because I was so healthy. I never had any major medical issues in my life before I got cancer. And the cancer is genetic. And it could have been triggered by a multitude of things. Birth control. I didn't know before I got cancer that doctors aren't supposed to prescribe you for birth control for everything under the sun related to your period conditions without first testing you for BRCA, especially if you have a history of cancer, because birth control can trigger the cancer gene and cause you to get cancer. Nobody told me that. Nobody said anything. That wasn't, a concern or whatever. So her concern was fake and disingenuous. And I said, I still don't want to take these pills anymore. There's no reason for us to continue discussing this. And she tried to be like, I don't know, she had like this fake condescending tone, like, oh, but what about your anxiety? What about what's going on in Gaza? What about, how traumatizing cancer was? You sure you don't want to continue with the pills? I thought they were helping you with your anxiety. And I said, I'll deal. I'll manage. I'll be perfectly fine. Oh, are you sure? Because, no, I'm fine. Like, she tried to make it seem like I was so ridiculous for wanting to not take these fucking pills anymore. And the reason why I say that, I feel like I wasn't talking to a medical professional anymore. I was talking to a salesperson, because it didn't feel like she was actually concerned about me and my overall health and well-being, because she would operate differently if that was the case. She was talking to me like a salesperson. Like, if you ever try to cancel cable and you get to run around, you say, I want to cancel cable, I don't want this plan anymore. And they, well, the best I can do is give you more cable. Like, that's what she was trying to do. Like, I would be like, I want to get off these pills. And be like, well, actually, I can give you a higher dose. I want to get off these pills. Well, actually, I can give you a higher dose and prescribe you this other pill on top of it. Well, I want to get off these pills. Well, the best I can do is give you a higher prescription and give you this other pill. Like, it didn't make any sense. Like, no sense whatsoever. And I'm like, is this a unique experience? Is this common? Do other people experience this? Because when I talk to other people that have taken like medication for their mental health, they meet their psychiatrist. They go and meet their psychiatrist in person. And it's more than just a checklist and a survey. It's several therapy sessions of them taking the time to get to know you and your needs in order to properly assess you and diagnose you before they give you a prescription. They're very reluctant to just, oh, okay, you came in here and you said that you got diagnosed with depression. Okay, well, here's the scripts for some antidepressants. That's not how that works. They usually have a vetting process. One, they want to make sure that you're not drug seeking, because there's an opioid epidemic. And, they don't want to be tied to, anything like that, because it'll get their medical license stripped. And two, if they're a good doctor and they actually care about their patients, they'd be like, wait, what's going on? Why do you feel like you need this? Is there an alternative? And they try and weigh the options before just giving you a prescription. So I just found this experience to be very odd and very confusing. And I'm glad that I took the initiative to slowly take myself off those pills in order to gain mental clarity so that I can understand what was going on. Because before, I'd be like, well, I don't understand what happened. She called me, I told her I didn't want to take the pills anymore, and next thing you know, I got a new prescription for the next month. Like, I was not able to fully comprehend what was going on because of those pills. And she was lying to me about the side effects and gaslighting me about my own experiences. And she was lying to me about being able to get off the pills safely. I didn't need a titrate plan. I could have stopped taking them anytime I wanted to. She just wanted me to continue taking the pills. It's as if she gets paid some type of commission for how many patients she can get on different types of pills, and she gets paid more based on how long you're on the pills. That's what it felt like. It didn't feel like I was talking to someone that was genuinely concerned for my overall health and well-being. So yeah, so I'm like, how come nobody told me that getting off mental health medication would be like trying to cancel cable in the early 2000s, or trying to cancel a fucking gym membership. They want you to send stuff in the mail, sign over your firstborn child, do a marathon, walk up the stairs backwards, and all this other stuff. But yeah, that's my story with dealing with anti-anxiety meds, and why I will probably never get on any other mental health drugs ever again. I'm perfectly fine with the anti-anxiety meds that I have that are like for panic attacks and like medical emergencies, and helping to calm me down so that I don't have to experience going through all of that without help. I don't have to panic. I don't have to, have my heart beat out of my chest. I don't have to deal with this heavy pressure in my brain and all these negative things that come with having a panic attack, having an anxiety attack. Like, I can use this to help nip that in the bud and my body can calm down. I'm perfectly fine with just doing that every once in a while as needed, rather than taking these fucking pills. I'm perfectly fine with just having tea, having a bite of an edible, doing 10 minutes of yoga, going for a walk, going on like the treadmill or the elliptical machine for like 30 minutes, or literally anything else other than these fucking pills and this lady that's trying to convince me to stay on pills that I don't freaking need. And she's interfering with my medical treatment in ways that she has no business doing. Social workers do not have medical degrees. They do not have nursing degrees. They should not be in this position at all. At the very least, it should be a therapist. It should be a nurse. It should be like a psychiatry tech that actually takes psychiatry classes or has some type of medical training, and not whatever the hell this was. I can't imagine how many other patients are negatively affected by this. I can't imagine how many patients are going through the same thing from the same person or dealing with other people who are displaying similar behaviors, who feel like they can't escape a pill that they don't want to take anymore because they don't like the side effects, and taking the pill is completely unnecessary. So thank you guys so much for watching. I've been posting a lot. I'm gonna try and stay consistent. If you guys follow me over from TikTok, thank you guys so much, and I sincerely hope that you enjoy my content. If you relate to the content of this video, please comment below. I would love to hear your stories and learn more about your experiences. Okay.